My name is Carrie Hodge. I joined DocGo in March 2021, and my role here is VP of Clinical Operations for Mobile Health. I am a two-time breast cancer survivor, though I like to use the word thriver instead, just because I, want to overcome this and learn from it and be stronger for it and share the knowledge and experience I have from it. When my mom was 41, she was diagnosed with breast cancer, and she had a strong family history of breast cancer, and at that time she had genetic testing done and found out that she had the BRCA gene. It's a gene that makes you very high risk for certain cancers, namely breast and ovarian, and so it presents itself very aggressively in women, but also men too. And she, at that time, decided to have some surgeries to prevent her chances of having recurrence of the cancer. And at that time, I was also tested and found out that I was also a carrier for that gene. And one of the great things is, like, with the research and the funding that's been put into breast cancer, especially genetic breast cancers, there's been lots of great progress with medications and screening and options for people that carry the gene. So I decided to get tested. I was positive and was put on a screening protocol where I had a mammogram and an ultrasound every year, and then 6 months later I had MRIs. And in between one of those tests, when I was 34 years old, I developed my first breast cancer. And I think getting that diagnosis at any time is pretty shocking, but I was a single mom of a 3-year-old, and it scared the crap out of me. And I went through chemo. I had to go through chemo, no radiation, and I also had a lot of surgery at the time. And losing your hair at 34 is no fun, but I got through it, and thought I was past it because I had found it at a fairly early stage. We had treated it very aggressively, and I had taken a lot of surgical measures to make sure that it wouldn't come back. Fast forward 5 years, and I was in the shower and felt something strange, and lo and behold, I had a new primary breast cancer. So we did beat the other one, but a new one somehow emerged in some residual breast tissue that I had after all my surgeries. And this one was more advanced, and I had to go through much more aggressive treatment this time. It was about 8 months of chemo and radiation, and it was much more soul-wrenching for me this time. Definitely put things in my life that were important to me in perspective. And I lost my hair a second time in my 30s. And now, 3 years later, so far so good. I don't sit still very well. And I will say, during that treatment regimen, I watched all of Downton Abbey and was very, very grateful that that show was ever broadcast, because it killed a lot of hours for me where I wasn't feeling good. But I worked when I could. Like I said, I had very clear vision about what was important to me, and I find deep sense of purpose in what I do for a living and the work I do. It's not just a job to me. And I want to make a big difference in healthcare and people's lives. And I had a lot of balls in the air when I found my diagnosis, and I did not want to see any of them fall. Like, I cared too much. I think it was also a good distraction for me on the days that I felt well. And luckily at the time I worked for an organization that was really supportive of that, and did what I could. At another meeting that I was at work, some of the chemo made my platelets very low, so I would sometimes get bloody noses, and I was talking to somebody, and I was having like a very in-depth clinical discussion about something and an idea that I had, and they looked very distracted, and I didn't even realize it, but I just had blood going down my face. So that was no fun at work. And then one of the chemos I had is the kind of chemo that makes your hair kind of all fall out at once. And I was at a work meeting and brushed my hand through my hair and I had a handful of hair. So that was a pretty humbling day. I had to excuse myself that day. But you know what? It's just hair. It doesn't feel like just hair when you're losing it. But it wasn't more important than, you know, what I wanted to do there that day. But I didn't think everybody needed to see that, so I left. Going through cancer treatments like running a marathon, it builds upon itself. So I found for me that once I got through the chemo, I felt this immediate sense of relief because I was, you know, I didn't feel great. I was swollen from all the steroids. My body was tired. Like, I have a small driveway, and I went from being a person that would run like 5 or 6 miles a day to a person that would walk to the end of the driveway and have to take a break because I was out of breath, and my driveway is like 30 feet. So I like very quickly was like, I want to get my strength back, but then I had to start radiation. And radiation on the other end of chemo is like sneaky. It builds upon itself also. And so initially I started feeling better as my body was healing from the chemo. And then the radiation has a cumulative effect. And so I think towards the end of that, when I got really tired from that, that was a hard moment for me because I thought I was past the hard stuff and it knocked me back down again. The other thing I think about cancer is that you never get to breathe that sigh of relief. Like, there's always a monkey on your back, and you know, I do feel like as long as I'm doing the right things, taking care of myself, going for my screenings, the whole like concept that you know, you're never totally out of it. There always feels like there's a monkey on your back. It also makes me really value my time. You know, there's only so many short days that we get in our lives, and we all have an expiration date. None of us know when it is going to be. But I want to fill those days with the things that are important to me, and I know what they are. It's my family, my daughter, and I want to make a big difference in people's lives in healthcare. And that's what I want to do with my days. I mean, don't get me wrong, I like a good beach vacation, I like sun, I like tropics, I like to travel, so I want to squeeze some of that in there too, but you know, the things that really are purposeful to me are those.